Professor LaShanda Taylor earned her BA at Spelman College and her JD at NYU. She was a Skadden Fellow, and as a Skadden Fellow, she developed a kinship caregiver representation project at the Children's Law Center and then continued on at the center as a staff attorney and director of the Family Permanency Project. She later taught at American University's Washington College of Law as a practitioner in residence with the General Practice Clinic. Prior to coming to UDC, she was a staff attorney for the ABA Center for Children and the Law. She will discuss the history of the HIV/AIDS legal clinic at UDC and how significant advances in HIV research and treatment since the clinic's inception in 1990 have impacted the clinic's mission. So there's less death.
Less death. Come on. Thank you, Joe, for that introduction. It's a pleasure to be here today to speak to you about the HIV/AIDS legal clinic here at UDC. The clinic was started in 1990 and has the distinction of being the second oldest of such clinics in the nation. And I've had the privilege of teaching in the clinic since 2009. To provide some context, in 1990, when the clinic started, there were an estimated 8 million people worldwide living with HIV. The clinic was started just 9 years after medical professionals in the United States had recognized the HIV epidemic. And just 3 years after the FDA had approved its first medication for the treatment of AIDS. At that time, the life expectancy for a symptomless person with HIV was less than 7 years. Fast forward to 2013. There are currently 34 million people worldwide living with HIV. And last year, the FDA approved the first medication to reduce HIV risk. An American diagnosed with HIV can now expect to live about 24 years on average. So much has changed. Much has changed within the research and treatment of HIV and AIDS, and much has changed in the District of Columbia. But the clinic's mission to provide comprehensive and holistic legal services to families and persons affected by HIV and AIDS has remained the same. However, our client base, our casework, and our overall approach to meeting that mission has changed. And I'd like to talk to you a little bit about those three things. First, our client base. In the early years of the clinic, the clients were primarily, if not entirely, from DC's gay male community. But as the face of HIV in the District of Columbia has changed, so have our clients. Currently, the majority of our clients are African American females. Research studies found that although the impact of HIV/AIDS epidemic in DC is greater among men overall, HIV prevalence is higher among Black women compared to white men. In DC, Black women represent 34% of African Americans living with HIV and 92% of women living with the virus. Our casework. For a number of years, the clinic's focus was primarily on end-of-life services, providing wills, living wills, powers of attorney, and standby guardianships for people with HIV. However, as I mentioned earlier, because our clients are living longer, the demand for these services has decreased. And while we still provide them, more and more our clients are asking us to assist them with accessing appropriate housing and public benefits. Students are filing reasonable accommodation requests to move clients into apartments, out of communal living facilities, which are harmful for people with compromised immune systems. And they're also filing ADA requests to get repairs made in existing apartments. The clinic also has a number of Social Security cases and is examining ways to enforce the Social Security Administration's mandate to update the HIV listings for Social Security benefits. Our overall approach has also changed. In the early 1990s, medical legal partnerships were central to the clinic's clinic structure. The clinic currently has partnerships with hospitals and community service providers throughout the city, including Washington Hospital Center, Project Stable Families, the Women's Collective, HIPS, the Ophelia Egypt Center, and Community Connections. The clinic also has a strong presence in those wards in the district that are most affected by HIV and AIDS. In Ward 7, every year, the clinic hosts an event to commemorate World AIDS Day, as well as events on National HIV and AIDS Testing Day. Although HIV cases are throughout the city, Ward 7 has one of the highest rates in the city, with 2.6% of the adults living in that ward affected by HIV. In an effort to further reach people who are most at risk for HIV infection, the clinic just last year began partnering with HIPS, which stands for Helping Individual Prostitutes Survive. And once a week, clinic students accompany HIPS personnel to provide brief advice and referral services for the persons who participate in their needle exchange program. And just as a side note, the number of new HIV/AIDS infections diagnoses in the district has been reduced by 70% since 2006 as a result of needle exchange programs. So the clinic has evolved over the years as the needs of our clients have evolved. And the clinic of today looks very different than the clinic of yesterday. And it's my hope that one day there will be no need for an HIV/AIDS legal clinic in the District of Columbia. Thank you.
Thank you very much, LaShanda.